Hi, my name is Alex and this workshop is brought to you by Ethical Health Solutions, where healthcare solutions are ethically crafted. Hello, this is Alex again. Welcome to part 3 of Exploring Healthcare Ethics, a workshop for healthcare professionals. In today's session, we will engage in small group discussions on ethical considerations, various perspectives, and potential courses of action. As mentioned earlier, we will work on 8 cases for our group discussion. You can pause the session by clicking the pause button or wait for the progress bar to complete before proceeding with the discussion. The first case is end-of-life care. Ethical consideration. Balancing patient autonomy with the duty to preserve life. Perspectives. Discuss various cultural, religious, and personal beliefs regarding end-of-life decisions. Potential courses of action. Explore options for providing compassionate end-of-life care while respecting patient wishes and maintaining ethical integrity. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Ethical consideration. Balancing patient autonomy with the duty to preserve life. The ethical dilemma in end-of-life care often revolves around respecting a patient's autonomy, honoring their wishes and decisions about their own care, while also considering the healthcare provider's duty to preserve life. This balance requires careful consideration of the patient's values, informed consent, and the potential benefits and burdens of continued treatment. Perspectives. Discuss various cultural, religious, and personal beliefs regarding end-of-life decisions. Cultural beliefs. Different cultures have varied perspectives on end-of-life care. For instance, some cultures prioritize family decision-making over individual autonomy, while others might emphasize the patient's personal choice. Religious beliefs. Religious beliefs can significantly influence end-of-life decisions. For example, some religions may oppose the withdrawal of life-sustaining treatments, viewing it as contrary to the sanctity of life, while others might support palliative care and hospice as a means to ensure a peaceful and dignified end. Personal beliefs. Individual patients may have unique preferences based on their life experiences, personal values, and previous encounters with healthcare. Some might prioritize quality of life over longevity, preferring to avoid aggressive treatments that may prolong suffering. Potential courses of action. Explore options for providing compassionate end-of-life care while respecting patient wishes and maintaining ethical integrity. Advanced care planning. Encourage patients to articulate their wishes through advanced directives, living wills, or healthcare proxies to ensure their preferences are known and respected. Palliative care. Provide comprehensive palliative care that focuses on symptom management, emotional support, and improving quality of life for patients with serious illnesses. Ethics consultation. Utilize hospital ethics committees or consultants to help navigate complex decisions, ensuring that ethical principles are upheld while respecting patient autonomy. Cultural competency training. Equip healthcare providers with training on cultural competence to better understand and respect the diverse beliefs and values of patients. Family involvement. Engage family members in discussions, respecting their input and ensuring they understand the patient's wishes and the ethical considerations involved. Holistic care. Address the physical, emotional, spiritual, and social needs of patients, providing a holistic approach to end-of-life care that honors their dignity and autonomy. By considering these perspectives and potential courses of action, healthcare providers can navigate the complex ethical landscape of end-of-life care with compassion and integrity. The second scenario is resource allocation during crisis. Ethical consideration. Allocating scarce medical resources fairly and transparently. Perspectives. Consider the viewpoints of healthcare providers, patients, and policymakers on prioritizing resource allocation. Potential courses of action. Discuss ethical frameworks for decision-making, such as utilitarianism or justice-based approaches, and explore strategies for maximizing resource utilization while minimizing harm. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Ethical consideration. Allocating scarce medical resources fairly and transparently. During a crisis, such as a pandemic or natural disaster, the ethical challenge lies in distributing limited medical resources in a manner that is both fair and transparent. This involves ensuring that decisions are made equitably and that the rationale behind these decisions is clear to all stakeholders. Perspectives. Consider the viewpoints of healthcare providers, patients, and policymakers on prioritizing resource allocation. Healthcare providers. Providers are often on the front lines, making critical decisions about who receives care. Their perspective typically focuses on clinical criteria and the potential outcomes for patients, aiming to save the most lives or maximize the benefits of treatment. Patients. Patients and their families might have varying expectations and needs, often advocating for immediate and comprehensive care. Their perspective emphasizes personal health outcomes and the right to access necessary treatments. Policymakers. Policymakers are responsible for creating guidelines and frameworks for resource allocation. Their perspective includes a broader view of public health, aiming to ensure that resources are used effectively across the population to achieve the greatest overall benefit. Potential courses of action. Discuss ethical frameworks for decision-making, such as utilitarianism or justice-based approaches, and explore strategies for maximizing resource utilization while minimizing harm. Ethical frameworks. Utilitarianism. This approach seeks to maximize overall good by allocating resources in a way that produces the greatest benefit for the largest number of people. During a crisis, this might mean prioritizing those with the highest chance of recovery or those who can be treated with the least resources. Justice-based approaches. These approaches emphasize fairness and equality, ensuring that all individuals have an equal opportunity to receive care. This might involve random allocation or prioritizing the most vulnerable populations. Strategies for maximizing resource utilization. Triage protocols. Develop and implement triage protocols that help healthcare providers make consistent and fair decisions under pressure, based on predetermined criteria such as severity of condition, likelihood of survival, and resource availability. Resource sharing. Encourage collaboration between institutions and regions to share resources and expertise, ensuring a more balanced distribution of care across affected areas. Ethics committees. Establish ethics committees to provide guidance and oversight on difficult allocation decisions, ensuring that ethical principles are consistently applied. Transparent communication. Maintain clear and transparent communication with the public about how and why allocation decisions are made, fostering trust and understanding. Ongoing review. Regularly review and adjust allocation policies based on evolving circumstances and feedback, ensuring that they remain fair and effective throughout the crisis. By considering these perspectives and potential courses of action, healthcare systems can navigate the complex ethical challenges of resource allocation during a crisis, aiming to provide equitable and effective care while maintaining public trust. Informed consent. Ethical consideration. Ensuring patients have sufficient information to make autonomous decisions about their care. Perspectives. Share personal experiences or hypothetical scenarios illustrating challenges in obtaining informed consent. Potential courses of action. Brainstorm strategies for improving the informed consent process, such as enhancing communication skills, providing written materials, or using decision aids. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Informed consent discussion. Ethical consideration. Ensuring patients have sufficient information to make autonomous decisions about their care. The ethical challenge in obtaining informed consent lies in providing patients with all necessary information in an understandable manner, allowing them to make informed and autonomous decisions about their medical care. This includes explaining the nature of the treatment, potential risks and benefits, alternatives, and the potential outcomes of not receiving treatment. Perspectives. Share personal experiences or hypothetical scenarios illustrating challenges in obtaining informed consent. Healthcare providers. Providers might encounter patients with varying levels of health literacy, language barriers, or cognitive impairments, making it difficult to ensure full comprehension. For example, a patient with limited understanding of medical terminology might struggle to grasp the complexities of a surgical procedure. Patients. Patients may feel overwhelmed by the amount of information provided or may not fully understand their condition and the proposed treatment. For instance, a patient facing a cancer diagnosis might be too distressed to process details about chemotherapy options and their side effects. Family members. Family members often play a crucial role in the consent process, especially for patients who are minors or have cognitive impairments. They may have their own concerns and questions that need to be addressed to support the patient effectively. Potential courses of action. Brainstorm strategies for improving the informed consent process. Enhancing communication skills. Training programs. Implement training programs for healthcare providers to improve their communication skills, focusing on techniques such as plain language, active listening, and empathy. Interactive dialogues. Encourage interactive dialogues where patients feel comfortable asking questions and expressing concerns, ensuring they fully understand their options. Providing written materials. Comprehensive brochures. Develop clear, concise brochures and handouts that outline the key aspects of the treatment, risks, benefits, and alternatives in layman's terms. Multilingual resources. Offer written materials in multiple languages to cater to patients from diverse linguistic backgrounds. Using decision aids. Visual aids. Utilize charts, diagrams, and videos to help explain complex medical information in an accessible manner. Digital tools. Provide access to digital decision aids, such as interactive apps or online platforms, which can guide patients through the decision-making process with tailored information and scenarios. Simplifying consent forms. Plain language. Revise consent forms to ensure they are written in plain language, avoiding medical jargon and technical terms. Step-by-step breakdown. Break down the consent process into manageable steps, clearly explaining each part of the form and its significance. Ensuring understanding. Teach-back method. Use the teach-back method, where patients are asked to repeat the information in their own words to confirm their understanding. Follow-up discussions. Schedule follow-up discussions to address any additional questions or concerns that patients may have after they have had time to consider the information. By implementing these strategies, healthcare providers can improve the informed consent process, ensuring that patients have the necessary information to make autonomous and well-informed decisions about their care. The next one is called Confidentiality and Privacy. Ethical consideration. Safeguarding patient confidentiality while promoting effective communication among healthcare team members. Perspectives. Discuss the impact of breaches of confidentiality on patient trust and confidentiality concerns in different healthcare settings. Potential courses of action. Explore technological solutions, policies, and training programs to enhance data security and reinforce confidentiality protocols. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Confidentiality and privacy discussion. Ethical consideration. Safeguarding patient confidentiality while promoting effective communication among healthcare team members. The ethical challenge in healthcare is to protect patient confidentiality while ensuring that necessary information is shared among healthcare team members to provide optimal care. This involves balancing the patient's right to privacy with the need for open communication within the healthcare team to deliver safe and effective treatment. Perspectives. Discuss the impact of breaches of confidentiality on patient trust and confidentiality concerns in different healthcare settings. Patients. Breaches of confidentiality can significantly undermine patient trust in the healthcare system. Patients who feel their private information is not secure may be less willing to disclose important health details, which can adversely affect their care. Healthcare providers. Providers might face dilemmas when they need to share patient information for collaborative care while being mindful of confidentiality. In settings such as mental health or substance abuse treatment, the sensitivity of information heightens these concerns. Healthcare settings. Different settings present unique challenges. For example, in a hospital, there is a higher risk of accidental exposure of patient information due to the number of individuals involved in care. In contrast, in a private practice, the concern might be more about securing digital records and maintaining confidentiality in smaller, more personalized environments. Potential courses of action. Explore technological solutions, policies, and training programs to enhance data security and reinforce confidentiality protocols. Technological solutions. Encryption. Implement robust encryption methods for all digital records to ensure data is protected both in storage and during transmission. Access controls. Use advanced access control systems to restrict information access to authorized personnel only, based on their role and necessity. Audit trails. Incorporate audit trails in electronic health records, EHR, systems to monitor and log access and modifications to patient data, ensuring accountability. Policies. Clear guidelines. Develop and enforce clear policies outlining how and when patient information can be shared, ensuring that all team members understand their responsibilities. Regular audits. Conduct regular audits of data access and sharing practices to identify potential vulnerabilities and ensure compliance with confidentiality protocols. Patient consent. Ensure that patients are fully informed about how their information will be used and shared, obtaining explicit consent where necessary. Training programs. Privacy training. Provide comprehensive training programs for all healthcare staff on the importance of confidentiality, data protection laws, and best practices for safeguarding information. Scenario-based training. Use scenario-based training to help staff understand and navigate real-life situations involving potential breaches of confidentiality. Ongoing education. Offer ongoing education opportunities to keep healthcare providers updated on new technologies, emerging threats, and evolving legal requirements related to data security and patient privacy. By addressing these areas, healthcare organizations can strengthen their confidentiality and privacy practices, thereby enhancing patient trust and ensuring compliance with ethical and legal standards. Cultural competence in care. Ethical consideration. Providing culturally sensitive care that respects diverse beliefs and practices. Perspectives. Share experiences of cultural misunderstandings or challenges in delivering culturally competent care. Potential courses of action. Identify strategies for improving cultural competence, such as cultural competency training, language interpretation services, or engaging community resources. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. We can now proceed to the discussions about the case. Cultural competence in care discussion. Ethical consideration. Providing culturally sensitive care that respects diverse beliefs and practices. The ethical challenge in healthcare is to ensure that care is culturally sensitive, respecting the diverse beliefs, values, and practices of patients from different backgrounds. This involves understanding and integrating these cultural aspects into the care plan to provide respectful and effective treatment. Perspectives. Share experiences of cultural misunderstandings or challenges in delivering culturally competent care. Healthcare providers. Providers may encounter situations where cultural misunderstandings impact patient care. For example, A provider might recommend a dietary change that conflicts with a patient's religious dietary restrictions, leading to non-compliance and frustration. Patients. Patients from diverse cultural backgrounds may feel misunderstood or marginalized if their cultural practices and beliefs are not acknowledged or respected by healthcare providers. For instance, a patient might be hesitant to follow medical advice if it contradicts traditional healing practices they trust. Healthcare settings. Different settings can present unique challenges. In urban hospitals with a high diversity of patients, the sheer variety of cultural needs can be difficult to manage. Conversely, in rural settings with less diversity, providers may have limited experience and resources to address cultural differences effectively. Potential courses of action. Identify strategies for improving cultural competence. Cultural competency training. Comprehensive training programs. Implement mandatory cultural competency training for all healthcare staff to enhance their understanding and ability to provide culturally sensitive care. Training should cover cultural beliefs, communication styles, and specific healthcare needs of diverse populations. Regular updates. Provide ongoing education and updates on cultural competence to ensure staff remain informed about the evolving cultural dynamics of the patient population. Language interpretation services. Professional interpreters. Ensure access to professional language interpreters, either in person or through telehealth services, to facilitate accurate communication with patients who have limited English proficiency. Bilingual staff. Recruit and retain bilingual staff who can directly communicate with patients in their preferred language, improving trust and understanding. Engaging community resources. Community partnerships. Establish partnerships with community organizations and cultural leaders to better understand and integrate cultural practices into patient care. This can include collaborating on patient education and outreach programs. Patient advocacy groups. Work with patient advocacy groups that represent diverse communities to gather feedback and develop culturally appropriate care strategies. Culturally sensitive policies. Incorporate cultural practices. Develop policies that accommodate cultural practices, such as allowing traditional healers to participate in the care process or providing space for religious practices. Flexible care plans. Create flexible care plans that can be tailored to respect cultural preferences, such as dietary restrictions, alternative therapies, and family involvement in decision-making. Enhanced communication. Cultural liaisons. Appoint cultural liaisons or patient navigators who can bridge the gap between patients and providers, ensuring cultural needs are communicated and addressed effectively. Patient education materials. Provide patient education materials in multiple languages and formats that are culturally relevant and easily understandable. By implementing these strategies, healthcare organizations can enhance their cultural competence, ensuring that all patients receive respectful and effective care that aligns with their cultural beliefs and practices. Conflict of interest. Ethical consideration. Managing conflicts of interest that may influence medical decision-making. Perspectives. Discuss scenarios where conflicts of interest may arise and their potential impact on patient care. Potential courses of action. Brainstorm ways to mitigate conflicts of interest, such as establishing clear policies, disclosing financial relationships, or involving impartial third parties in decision-making. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Conflict of interest discussion. Ethical consideration. Managing conflicts of interest that may influence medical decision-making. The ethical challenge is to identify and manage conflicts of interest, QA, that could influence medical decisions, potentially compromising the integrity of patient care. Ensuring that medical decisions are based solely on the best interests of the patient is crucial for maintaining trust and professional integrity. Perspectives. Discuss scenarios where conflicts of interest may arise and their potential impact on patient care. Healthcare providers. Providers might face QA when they have financial relationships with pharmaceutical companies, medical device manufacturers, or receive incentives for certain treatments. For instance, a doctor who receives compensation from a drug company might be more inclined to prescribe that company's medication, even if another drug would be more beneficial for the patient. Patients may feel their care is compromised or biased if they become aware of potential QA. For example, a patient might question whether a recommended procedure is truly necessary or if it is being suggested due to a provider's financial interests. Healthcare institutions. Institutions can also experience QA when they enter into partnerships or receive funding from certain companies, potentially influencing the treatments and technologies they promote. This can impact clinical guidelines and the availability of certain therapies. Potential courses of action. Brainstorm ways to mitigate conflicts of interest. Establishing clear policies. COI policies. Develop and enforce clear COI policies that require healthcare providers to disclose any financial relationships or potential conflicts. These policies should outline acceptable and unacceptable behaviors and provide guidance on managing disclosed QA. Regular audits. Conduct regular audits to ensure compliance with COI policies and identify any undisclosed conflicts. Disclosing financial relationships. Transparency. Require providers to disclose any financial relationships with pharmaceutical companies, medical device manufacturers, or other entities to patients and colleagues. This transparency helps maintain trust and allows patients to make informed decisions. Public databases. Maintain publicly accessible databases of provider financial relationships, allowing patients to review potential QA. Involving impartial third parties in decision-making. Ethics committees. Utilize hospital ethics committees to review cases where QA are identified, ensuring that decisions are made in the patient's best interest without bias. Independent review boards. Implement independent review boards for clinical trial designs, research funding, and treatment recommendations to avoid QA influencing these areas. Education and training. COI training. Provide regular training for healthcare providers on identifying, disclosing, and managing QA. This training should emphasize the importance of maintaining patient trust and professional integrity. Ethical decision-making. Incorporate training on ethical decision-making frameworks to help providers navigate situations where QA might arise. Creating a culture of integrity. Leadership commitment. Ensure that leadership demonstrates a strong commitment to ethical practices and sets a tone of integrity throughout the organization. Open dialogue. Foster an environment where open dialogue about QA is encouraged and supported, allowing providers to discuss potential conflicts without fear of retribution. By implementing these strategies, healthcare organizations can effectively manage conflicts of interest, ensuring that medical decision-making remains unbiased and prioritizes patient well-being. Genetic testing and privacy. Ethical consideration. Balancing the benefits of genetic testing with privacy concerns and potential discrimination. Perspectives. Share views on the ethical implications of genetic information disclosure and privacy protection. Potential courses of action. Discuss policies and practices to ensure informed consent, protect genetic data, and address concerns about discrimination based on genetic information. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Genetic testing and privacy discussion. Ethical consideration. Balancing the benefits of genetic testing with privacy concerns and potential discrimination. The ethical challenge is to maximize the benefits of genetic testing, such as early disease detection and personalized treatment plans, while safeguarding patient privacy and preventing genetic discrimination. This involves ensuring that genetic information is handled with the utmost confidentiality and that patients are fully informed about the implications of testing. Perspectives. Share views on the ethical implications of genetic information disclosure and privacy protection. Healthcare providers. Providers must balance the need to utilize genetic information for better patient outcomes with the responsibility to protect patient privacy. There is a concern about how genetic data might be shared within the healthcare system and with third parties, such as insurance companies. Patients. Patients may fear that their genetic information could be used against them, leading to discrimination in employment or insurance. They might also worry about the implications of genetic data for their family members, who could be affected by revelations about hereditary conditions. Policymakers. Policymakers focus on creating regulations that protect individuals from genetic discrimination while promoting the responsible use of genetic information for public health benefits. They must navigate the complexities of consent, data security, and ethical use of genetic data. Potential courses of action. Discuss policies and practices to ensure informed consent, protect genetic data, and address concerns about discrimination based on genetic information. Ensuring informed consent. Comprehensive consent processes. Develop detailed consent processes that clearly explain the purpose, benefits, risks, and potential outcomes of genetic testing. Patients should be made aware of who will have access to their genetic data and how it will be used. Educational materials. Provide patients with easy-to-understand educational materials about genetic testing, including potential privacy concerns and the implications of test results for themselves and their families. Protecting genetic data. Data security measures. Implement robust data security measures, such as encryption, secure storage, and access controls, to protect genetic information from unauthorized access and breaches. De-identification of data. Use techniques to de-identify genetic data where possible, reducing the risk of it being linked back to individual patients. Addressing discrimination concerns. Legislation. Advocate for and enforce laws that prohibit genetic discrimination in employment and insurance, such as the Genetic Information Non-Discrimination Act, GINA, in the United States. Ensure these laws are regularly updated to address emerging issues. Ethical guidelines. Develop and promote ethical guidelines for the use of genetic information in clinical and research settings, ensuring that the potential for discrimination is minimized. Creating a supportive environment. Counseling services. Offer genetic counseling services to help patients understand their test results and the potential impact on their privacy and life choices. Counselors can provide guidance on managing the emotional and social implications of genetic information. Patient advocacy. Support patient advocacy groups that work to protect the rights and privacy of individuals undergoing genetic testing, and involve them in policy development and decision-making processes. Transparency and accountability. Regular audits. Conduct regular audits of genetic testing practices and data handling procedures to ensure compliance with privacy standards and identify areas for improvement. Public reporting. Encourage transparency by reporting on how genetic data is used, protected, and shared, building public trust in genetic testing programs. By implementing these strategies, healthcare providers and policymakers can balance the benefits of genetic testing with the need to protect patient privacy and prevent discrimination, ensuring that genetic information is used ethically and responsibly. Truthfulness and disclosure. Ethical consideration. Maintaining honesty and transparency in communication with patients, even in challenging situations. Perspectives. Reflect on experiences or hypothetical scenarios involving medical errors or adverse events and decisions about disclosure. Potential courses of action. Explore communication strategies for disclosing errors, supporting patients and families, and fostering a culture of openness and learning in healthcare organizations. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Truthfulness and disclosure discussion. Ethical consideration. Maintaining honesty and transparency in communication with patients, even in challenging situations. The ethical challenge in healthcare is to maintain honesty and transparency with patients, especially when communicating about medical errors or adverse events. Upholding these principles is essential for building trust, ensuring patient safety, and promoting ethical integrity within the healthcare system. Perspectives. Reflect on experiences or hypothetical scenarios involving medical errors or adverse events and decisions about disclosure. Healthcare providers. Providers may face difficult decisions when disclosing medical errors. For example, a surgeon who realizes a mistake was made during an operation must balance the duty to inform the patient with the fear of legal repercussions and potential damage to professional reputation. Patients and their families expect honesty from their healthcare providers. When errors are disclosed transparently, patients are more likely to maintain trust in their providers and the healthcare system. Conversely, lack of transparency can lead to loss of trust, increased anxiety, and reluctance to seek future care. Healthcare institutions. Institutions must create an environment that encourages transparency and supports providers in disclosing errors. This can be challenging due to concerns about liability and public perception. Potential courses of action. Explore communication strategies for disclosing errors, supporting patients and families, and fostering a culture of openness and learning in healthcare organizations. Communication strategies for disclosing errors. Prepare and plan. Before disclosing an error, healthcare providers should gather all relevant information, anticipate patient and family reactions, and plan the conversation to ensure it is clear, compassionate, and supportive. Be honest and apologetic. Providers should be honest about what happened, explain the error in understandable terms, and offer a sincere apology. Acknowledging the error and taking responsibility is crucial for maintaining trust. Provide next steps. Explain the steps being taken to rectify the error and prevent it from happening again. This includes discussing any additional treatments or follow-up care required. Supporting patients and families. Offer emotional support. Provide emotional support to patients and families affected by the error, including access to counseling services or patient advocates who can help them navigate the situation. Involve them in the process. Involve patients and families in the investigation and resolution process, ensuring they feel heard and valued. This can help restore trust and empower them in their care journey. Fostering a culture of openness and learning. Encourage reporting. Develop a non-punitive reporting system that encourages healthcare providers to report errors and near misses without fear of retribution. This helps identify patterns and areas for improvement. Regular training. Provide regular training on communication skills, particularly on how to disclose errors and adverse events effectively. Training should emphasize empathy, transparency, and patient-centered care. Systematic review and improvement. Establish protocols for systematic review of errors and adverse events to identify root causes and implement corrective actions. Share lessons learned across the organization to prevent future occurrences. Leadership commitment. Ensure that leadership demonstrates a commitment to a culture of openness and learning. Leaders should model transparency and support staff in disclosing errors and engaging in continuous improvement. Policy development. Create and enforce policies that require the disclosure of medical errors and adverse events, outlining clear procedures and support mechanisms for providers. By adopting these strategies, healthcare organizations can promote honesty and transparency, support patients and families affected by errors, and create a culture of continuous learning and improvement. This approach not only enhances patient trust and safety but also fosters a more ethical and accountable healthcare environment. This is where this part ends. Please proceed to the next part and don't forget to share your thoughts with us. Leave a comment below or send us an email at info@ethical-healthsolutions.com with the subject line, feedback. Thank you. Alright, don't forget to subscribe and hit the bell button to receive notifications for new videos from us. Goodbye.